On August 10th, when schools reopen, children can expect to be greeted at their schools by something like this: a mandatory hand washing station that all schools are required to implement. This is only one of the requirements that the Ministry of Education is asking all schools to put in place before the children return. In its school readiness monitoring instrument, the Ministry of Education notes that each school should have a sufficient number of hand washing facilities, which translates to 1 for every 50 students. But that's just one of several changes teachers and administrators have had to implement as Belize prepares to reopen its schools in a pandemic. The other challenge is social distancing. A classroom like this on an average year would accommodate about 30 to 40 students. But with social distancing requires, students have to be 3 feet to 6 feet apart, which means this classroom will only hold about 18 students. Here at Holy Redeemer, they're implementing a shift schedule, which means one group in the morning and one group in the afternoon. Other schools have opted for alternate day schedules, and some are mixing both online and in-person classes. At most schools, though, teachers and administrators are still finalizing their classrooms for the new school norm. This includes adequate signage for hygiene and hand washing, demarcating 6 feet markers, and retrofitting an isolation area like this one, which will be furnished to hold children or teachers who feel sick at school. Preparations aside, there's still a great deal of hesitation by parents about sending their children back to school. In an online poll conducted in July by a Belizean company, Digital Learning and Pedagogical Solutions, when the participants were asked, "Will you be sending your children for face-to-face instruction this year?" Of the 2,462 responses, only 18.6% said yes, and the majority, 54.7%, said maybe. Director of Health Services Dr. Marvin Manzanero acknowledges the hesitation he's seen from parents.
With what we now know of COVID-19, we know it's not going to go away. We know it's not the vaccine, even though there's advances in 3 of them. It doesn't mean that you're going to have a vaccinated population that will be able to go back to doing routine activities 1 year from now. May very well be 2 years from now. Even international air travel, they are saying 4 years from now, we'll go back to where it was. So based on that, then you have to learn to find a mechanism for not only the school opening, but other issues in terms of how you go about doing your normal routine. So I know there's a lot of resistance, there's a lot of hesitancy for all the reasons that we know. But some of that has to do with fear of the unknown. We don't know what's going to happen.
While there still is a lot of unknowns about COVID and its impact on children, according to Manzanero, it is still believed that severe risks for children are still low.
Children are going to have the same, depending on the level of exposure, the same risk of becoming infected.
And do we know what percentage? Is it similar to what we see in the adult population, the percentage of how many children will get severe symptoms?
It seems to be less than adults. For adults, 20% is still around the hovering amount, although populations change. Mexico seems to have a higher number of patients hospitalized than other countries. For children, it would seem to be around 5%, much, much less than for adults.
Even with the proximity to school reopening and the return of travel, Manzanero says he sees the children's return to the classroom as an opportunity.
I know that one of the key concerns people have is that the virus is practically going to land on the first plane August 15th. The last repatriation flight that came did not have any COVID-19 case. But I don't think that that should be the mindset. I think as we go about, we have to think that COVID-19 is around us. It's not going to land necessarily in the first plane. So I think that's the education process that we need to start. We need to start telling people that anybody you meet on the street really is a potential case. For adults, it's more difficult for us to change our behavior. It may very well be the opportunity that children can be taught those mechanisms, those principles of adequate hand washing, adequate hand hygiene.
But Dr. Manzanero, as we've heard from others like the Prime Minister and the Minister of Education, warns that all these plans are tied to the fact that we currently have no community transmission.
We don't have community transmission. So I think if you're asking for the adequate time, it would be now. You can't compare dynamics of other epidemics and put it in our schools setting or in our community setting. But again, that changes. Once you start having community transmission, the ball game changes.
So come August 10th, the children will strap on their backpacks and face masks and return to their socially distanced classrooms.